Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hello, everyone, and welcome back to another episode of What Did the Patient Say with our patient interview series. My name is Dr. Matthew Peterson, and today we're going to be talking with my patient, Gerry, about her experience going through treatment at CFNC for what turned out to be spinocerebellar ataxia. So thank you for joining us today, Gerry.
Sure. Glad to be here.
I'm glad that you're here. So to start this whole thing off, could you share with us kind of what symptoms you were experiencing initially and when they all kind of started?
My symptoms started a number of years ago. I can't remember the exact year, but I began having these involuntary slight movements of my head, kind of shaking side to side. Saw a neurologist who diagnosed cervical dystonia. This happened within weeks after I had experienced a very traumatic incident. It was a situation where I was home in our remote mountain home. My husband was away in Yellowstone National Park volunteering for the summer, and the trauma was that someone who had actually hit my car on the road a few days earlier threatened me with a gun. So it was very traumatic. That situation didn't last very long because the person left my property and I filed charges and all of the legal bit, but I was left with this involuntary motion in my head. I thought I was okay, but that was the original thing that started it, and the original diagnosis was cervical dystonia.
Gotcha. And then from there, you started to experience some other symptoms, correct?
That is correct. It was sort of a progression. The cervical dystonia was the beginning. After that, I would have periods of dizziness. My primary care thought it was vertigo, had brain MRIs to perhaps rule out a stroke. Nothing showed any evidence of anything abnormal. So went from cervical dystonia to periods of dizziness, the nystagmus, or as I always refer to it, my bouncing eyes, came along after that. And the latest symptom that I experienced was difficulty walking. My gait was impaired. I was walking like I was drunk when I had had a thing to drink. So that's been the progression of what I have experienced symptom-wise.
Yeah. Well, thank you for sharing that, Gerry. You touched on it a little bit as far as going for some diagnostic testing with other providers and neurologists. Did you end up having any treatment prior to coming to see us at CFNC?
Oh my goodness, I had lots of stabs in the dark, I would refer to it as. I had a number of different MRIs to make sure that the brain did not show any evidence of anything. I was treated with medications for vertigo, which did absolutely no good at all. I did 2 rounds of vestibular therapy. I did a number of different sessions of fairly ordinary physical therapy, and one of the providers there did some therapy to try to help my eyes. And quite frankly, I really didn't see any significant benefit from any of that. Certainly the medication for vertigo did nothing because it isn't vertigo.
Correct. And Gerry, how did you find us?
Okay, this is a bit of a longer story. I went for an eye exam with my regular eye doctor. Happened to go on a day that I was having incredibly bad nystagmus. The doctor took one look at me and said, "Gerry, I can't possibly examine your eyes. The nystagmus is so bad, you've got to see a different neurologist." So he referred me to someone that I had not previously seen. And in preparation for the appointment with that doctor, I read his bio, and he said he had an interest in functional neurology. I had never heard the term functional neurology. It was going to be weeks or perhaps, I think, about 2 months before I was going to see this doctor. So I go online, I Google functional neurology, Charlotte, and guess who pops up? So I found you myself. Nobody referred me. I found you because I was desperate for some help with the nystagmus particularly, but all the other symptoms as well.
Absolutely. And I think you said you came in or scheduled an appointment that next Monday, right?
Yes, I found online. I found you on Friday night. Monday morning, I called your office. I was like, okay, I think this is it. I think I have to see these practitioners and find out what functional neurology really is and can it help me.
And I am so glad that you did. So Gerry initially came to us, I believe, in July of 2024, and we've really been seeing her ever since. But as far as the initial round of treatment went, well, first we started with the exam, of course. And in that initial exam, we saw a lot of the things that Gerry described. So the first being when we checked her eyes, we saw a nystagmus. And for those who don't know, a nystagmus describes the eyes drifting one way and then jumping back the other. So when she says her jumping eyes, she means it quite literally. And for a lot of people, that can be pretty disorienting. It's a sign that we classically see with different types of vestibular conditions, but it can also be associated with cerebellar conditions, which makes sense because the cerebellum is very closely related in function, or it works very closely with the vestibular system. And so we saw right away Gerry had a nystagmus, not only when we put her in the dark and we're watching her eyes with cameras, but even when I was looking at her face to face, you could see her eyes just jumping away. Another important finding that she mentioned was her walk, we described it almost more like a waddle. She was very wide-based gait, and she was not exaggerating when she said it. It looked like she had had one too many. What was really interesting with really all the findings in Gerry's exam that were positive, many of which were cerebellar in nature, they all got better if we had Gerry do something called dual task, which is basically, it's kind of like multitasking, or you can think of it as walking while you chew bubble gum. We give you something to do to occupy your brain while you are also doing another task. And I remember having Gerry walk down the hallway with her waddle initially, And then we had her, okay, this time I want you to say every other month of the year out loud while you walk. And immediately Gerry just started striding away. And I remember she turned around and looked at me and she said, "What was that?" And that's where we learned, all right, Gerry's frontal lobes are looking great. So we're gonna utilize that to our advantage. So a lot of Gerry's therapy was really focusing on just rehabbing that cerebellum. So doing things like complex movements, doing different eye movement exercises to try and attenuate that nystagmus, as well as using things like vibrational therapy and electrical stimulation. After the first round of treatment, Gerry was noticing some pretty good improvement, and we were like, okay, we want to capitalize on this momentum that we've built. So we started sending Gerry home with more and more home exercises and kind of spreading out how often we were seeing her in the office. But a lot of those home exercises were things like doing the New York Times puzzles in the morning. Start your day off with a cognitive task. And Gerry, I think you can attest to, you notice that on the days that you didn't do it, you felt a little bit more off than on the days that you did.
Oh, absolutely. I mean, the day must start with engaging my brain in fun things. Otherwise, I'm going to have a really not so good day.
Absolutely. And I think that's also one of the things that's so cool about functional neurology is we can take such seemingly simple things or even what someone might see as a mundane task, and we can use it for therapy. And in Gerry's case, she finds those things very fun, so it worked out. As we continued to see Gerry, she had still been in touch with one of her other medical neurologists, and he had a suspicion that she might be dealing with spinocerebellar ataxia. And so at that point, he ran some genetic testing to see if that could in fact be the case. And she did test positive for Spinocerebellar Ataxia Type 34?
35.
35.
The gene is TGM6, I believe, is the gene that is not exactly happy in my body.
That's one way to put it, yeah. And so I think part of what kind of led us down this potential genetic rabbit hole was Gerry had mentioned that she had other family members that had similar symptoms of things like tremors, and your mom had gone through a lot of the same things.
Yes.
And so kind of tipped some hat or pointed us in that direction. And then we did eventually get confirmation. But the good news is this type of spinocerebellar ataxia, while it is considered a type of neurodegenerative disease, it is very slowly progressing in nature. And so that is partially why over the course of how many years now, Gerry has seen just kind of a steady, slow decline. But through the course of treatment from July up until now, Gerry, how would you say you would rate your overall improvement up to this point from when we first saw you until now?
My improvement is, I consider it dramatic. Every day is much easier to get through. I can do a lot of things that in the summer of last year, before I came to CFNC, there was no way that I could do quilting, which is one of my hobbies and something that I've done for years and am passionate about. There was no way I could do anything. Now I can work on my quilts, not for 8 hours at a time the way I used to, but 2 to 3 hours very comfortably, very easily. Other small things that are so much better, it's much more comfortable to read, which again is something I love. I'm better making meals in the kitchen because I've learned a lot of tricks on how to minimize the number of movements that I do and still get a meal on the table. So my husband's happy because he's eating better. Some of his favorite foods I can now cook. So every day they're just ho-hum mundane things that I can do that I couldn't do 6 months ago. So it's dramatic.
That's awesome.
And that's why I have my home routine, which takes me about 25 minutes twice a day. And if I think, do I really want to do it this morning? The answer is absolutely, because the therapy with you and now the therapy at home is a big part of why I'm so much better, and I don't mind doing my part to keep it that way.
Absolutely. And Gerry has been what I would consider a hyper compliant patient. Anytime it's like I tell her, all right, Gerry, I want you to go home and I want you to jump, she says, how high? And she, your adherence to the treatment plan and your dedication to getting yourself better has been not only admirable, but has played a large role in getting you from where you were to where you are today. And so I want you to absolutely continue to keep up the good work.
Well, I will, because when I came to your clinic, I came there thinking there may be absolutely nothing that will make this any better. And I have learned, yes, there is. So doing my part to keep it that way is easy. It's just not a burden at all.
Awesome. And Gerry, I guess the last big question I have for you is, if you could give one piece of advice to somebody that could be a future patient at CFNC, what would that piece of advice be?
Be open-minded about what the possibilities are. And this is going to be a little bit long-winded, but accept the diagnosis. Okay. When you told me that it was a cerebellar problem, there's no use to argue about it. It's okay to say, yeah, there's a problem with a part of my brain. Let's see what we can do about it. So, accept the diagnosis, accept the fact that if you put some effort into it, there are things that can make it better and make your life better. So I think my big comment would be accept the help that is available, because it's there.
Awesome. Well, Gerry, thank you so much for joining us today and sharing your story. For everybody listening, if you have any questions, please leave a comment or feel free to reach out to us. Also, please visit our website at carolinafnc.com for additional information on our treatment programs. Gerry, thank you so much.
Enjoyed it. Good to see you.
Good to see you too, Gerry.